Imagine a drug so potent that just a few milligrams could mean the difference between life and death. Now, imagine that drug going missing in massive quantities from pharmaceutical supply chains, only to resurface on the streets, fueling one of the deadliest overdose epidemics in history. This is not a hypothetical scenario. It's the grim reality of the missing fentanyl supply and the opioid crisis that has been ravaging the United States for over a decade. Before we get started, make sure to subscribe and turn on notifications for in-depth coverage of true crime, unsolved mysteries, and the dark side of history. The rise of fentanyl, a game changer in the opioid epidemic. Fentanyl, a synthetic opioid, was originally developed in 1959 as a powerful painkiller for cancer patients and those undergoing major surgeries. It is up to 100 times stronger than morphine and about 50 times more potent than heroin. Its legitimate medical uses are highly controlled, yet in recent years, fentanyl has been increasingly diverted from legal supplies into the illicit drug trade, leading to a catastrophic surge in overdose deaths. The timeline of fentanyl's emergence as a street drug aligns closely with reports of mysterious disappearances from pharmaceutical inventories. From 2010 onward, as regulations tightened on prescription opioids like OxyContin and Vicodin, fentanyl began appearing in alarming quantities outside of hospital and pharmacy settings. The big question was, how was this happening? The mysterious disappearance of legal fentanyl. One of the most perplexing aspects of the fentanyl crisis is the staggering volume of the drug that has gone missing. Investigations have revealed that licensed medical professionals, including doctors, nurses, and pharmacy employees, have stolen fentanyl directly from hospitals and clinics. Some have siphoned vials meant for surgeries, replacing the liquid with saline to cover their tracks. Others have stolen fentanyl patches, extracting the potent gel and selling it on the black market. However, these thefts alone cannot account for the vast quantities of fentanyl flooding the streets. Authorities suspect that large-scale pharmaceutical shipments have been intercepted or manipulated before reaching their intended destinations. Reports from the Drug Enforcement Administration, DEA, suggest that organized crime syndicates may have infiltrated the supply chain, with insiders diverting fentanyl before it ever reaches pharmacies. In some cases, entire shipments of fentanyl have disappeared en route to their destinations. Truck drivers, warehouse workers, and even distribution center employees have been implicated in these schemes. The missing fentanyl then resurfaces in illicit drug labs, often mixed with heroin or pressed into counterfeit prescription pills, making it nearly impossible for users to gauge their dosage. The results are frequently fatal. Fentanyl's devastating impact on public health. The consequences of fentanyl's widespread availability have been catastrophic. According to the Centers for Disease Control and Prevention, CDC, fentanyl and other synthetic opioids were responsible for over 100,000 overdose deaths in the US in 2021 alone. The drug's extreme potency means that even experienced opioid users are at high risk of overdose. Just a few grains of fentanyl can be lethal, and many victims don't even realize they are consuming it. Dealers often mix fentanyl with other substances, such as cocaine, methamphetamine, or MDMA, to increase potency and addiction potential. The problem is that most users are unaware of this deadly combination. A single dose of what appears to be a standard pill or a bag of heroin could contain enough fentanyl to stop someone's breathing in minutes. The Chinese connection and the role of Mexican cartels. While some fentanyl comes from stolen pharmaceutical supplies, the majority of illicit fentanyl today is produced in clandestine labs overseas, primarily in China. For years, Chinese chemical manufacturers have been accused of supplying the precursor chemicals needed to synthesize fentanyl. These chemicals are then shipped to Mexico, where powerful cartels, such as the Sinaloa cartel and Jalisco New Generation Cartel, CJNG, manufacture the final product and smuggle it across the US border. Despite diplomatic pressure, China has struggled to regulate these operations, and many manufacturers have simply shifted production to unregulated areas. The result? a steady stream of fentanyl flooding into the US, fueling the overdose crisis at unprecedented levels. Government crackdowns and the struggle to contain the epidemic. In response to the crisis, US authorities have launched aggressive crackdowns on fentanyl trafficking. Border security has been ramped up, with customs agents using advanced scanning technology to detect fentanyl shipments. The DEA has targeted online marketplaces where fentanyl is sold, and law enforcement agencies have arrested numerous cartel affiliates operating within the country. However, despite these efforts, fentanyl remains more accessible than ever. The drug is cheap to produce, highly addictive, and easy to transport in small quantities, making it a lucrative commodity for traffickers. Additionally, new fentanyl analogs, slightly modified chemical variants, continue to emerge, complicating law enforcement efforts to regulate and ban these substances effectively. Harm reduction strategies, a new approach. Recognizing that traditional law enforcement efforts alone cannot solve the fentanyl crisis, many public health advocates have pushed for harm reduction strategies. These include naloxone distribution. Naloxone, Narcan, is a life-saving drug that can reverse opioid overdoses. Making it widely available has proven effective in reducing fentanyl-related deaths. Supervised consumption sites. Some cities have experimented with providing safe spaces where users can consume drugs under medical supervision, reducing the risk of fatal overdoses. Fentanyl test strips. These allow users to test substances for fentanyl contamination, potentially preventing accidental overdoses. Medication-assisted treatment, MAT. Programs that provide methadone or buprenorphine help people struggling with opioid addiction transition off dangerous street drugs. As the fentanyl epidemic continues to evolve, the challenge remains daunting. The missing pharmaceutical supply is just one piece of a much larger puzzle that includes international trafficking networks, regulatory loopholes, and the persistent demand for opioids among addicted individuals. The fight against fentanyl will require a multifaceted approach, stronger supply chain security, international cooperation to cut off production at its source, and expanded public health initiatives to reduce harm. But most importantly, it requires a societal shift in how we address addiction, not as a crime, but as a public health emergency that demands urgent attention. For now, the fentanyl crisis remains one of the most pressing public health challenges of our time. And until real solutions take hold, the drug's deadly grip will continue claiming lives at an alarming rate. If you enjoyed this video, please make sure to subscribe to our channel and hit the bell icon to never miss an update. Until next time.